Hello, everybody. My name is Lisa Deck, and I am a rare disease patient and a Rare New England board member. And today I am thrilled to be here to introduce the power of patient advocacy. We are thrilled to look at patient advocacy and its power to all the patients themselves, policy initiatives, and healthcare teams. We are very lucky today to have Shannon von Feldman, the Director of Rare Disease Legislative Advocates, which is a program of the Every Life Foundation for Rare Diseases, with us today for this meaningful conversation. Shannon works with rare disease advocates across the country to engage at the local, state, and federal level. She began her career on Capitol Hill as a legislative assistant for Congresswoman Shelley Berkeley of Nevada, working on healthcare and veterans affairs. Shannon has worked with national nonprofit organizations to further their policy and advocacy goals, including the Juvenile Diabetes Research Foundation and the National Osteoporosis Foundation. She received her Master of Public Policy from American University. I have had the pleasure of volunteering directly with Shannon on the RDLA Inaugural Advisory Committee, and am so pleased to introduce her to you today. Take it away, Shannon.
Thank you, Lisa, and thank you to Rare New England for having me today. As Lisa said, I've had a great opportunity to work with Lisa more closely over the last year or so, and it has been a pleasure doing so. I can't share slides and talk at the same time, so I apologize. But as Lisa said, I'm here to talk about the power of patient advocacy. I have some slides and remarks that I'm going to share with you all, and then we're going to have some time at the end for any questions that folks might have. So a little bit about the Every Life Foundation that I work for. We're a nonprofit, nonpartisan organization located in Washington, D.C. And we're really dedicated to empowering the rare disease patient community to advocate for legislation and policy that will advance the equitable development of treatments and cures and diagnostics. And so we don't speak for patients. That's one of the great things about the RDLA program. We're really providing the training, the education, and the resources for patients, their loved ones, their family members, their neighbors, to advocate for those in the rare disease community. So we do this in a number of different ways through rare disease legislative advocates, providing different educational tools, building awareness on Capitol Hill to ensure that Congress is actually hearing from patients and caregivers. And one of our biggest goals is to connect every member of Congress with a rare disease advocate so that they know when they're making decisions that it's going to be affecting real people such as yourselves. And I'm going to start. Many of you probably remember what it was like in the 80s during the HIV pandemic. And the AIDS movement was such a historic and landmark example of patient advocacy. AIDS activists were storming the FDA, demanding the FDA approve treatments for HIV to save the lives of HIV patients. And the FDA had to respond. They were forced to respond to these advocates that were literally laying on the ground outside the FDA with tombstones over their heads. And because of that advocacy, FDA created a whole new approval process, which has been in the news lately, called accelerated approval. But following accelerated approval, there was one of the biggest surges ever in innovation and has had a huge impact on rare diseases. And so the most important lesson from this is that patients, when they're educated and activated, they really are the most effective change makers. So there are so many different reasons to advocate. A lot of people think of advocacy as this really big, complicated term, but really you advocate because, for yourself or your loved one or your community, because you see that, there's a need for change or to solve a problem. And, those changes for the rare disease community, can range from closing the gap for FDA-approved treatments, eliminating the diagnostic odyssey, and ensuring access to safe and efficacious therapies as soon as possible. And it's important to note that, legislation and public policy has real world implications for patients and their families. Legislation and policy that Congress creates here in Washington, D.C. has real implications for impacting the science and the development of and access to treatment. So with that in mind, patients and other rare disease advocates have the power to affect change. And there are so many different ways to take a role and influence legislation and policy. So I am going to talk a little bit today about how to get started if you're new to advocacy, starting out on your advocacy journey, or need a refresher on how you can evolve as an advocate. And the key to success as an advocate is resiliency and perseverance. Advocacy is not a one-time action or event. It's not just sending an email or a phone call. It's continuing to work towards a goal and building relationships and finding a solution. So that is the key to success. And it's, DC is far away from a lot of folks. And I think at times especially when Congress is, there's a lot of fighting and bickering, especially partisan, it can feel really disappointing and frustrating. But it's important to keep in mind that your legislators do want to hear from you. You're the constituent. They work to represent you, and you're the expert in your rare disease and your experience. They have no idea what it's like to have a rare disease or a loved one with a rare disease, or to be a rare disease healthcare professional, unless you tell them what that experience is like. They don't know everything, and they need you to share that experience with them. And I mentioned building relationships as an advocate. Building relationships is really what you're doing as an advocate. Strengthening that relationship, making sure they're aware that you're there. And this survey was taken of congressional staffers a few years back, where they asked congressional staffers what types of contexts had the largest impact on the decisions that were being made in their office. And at the top, you can see that it's in-person visits from constituents. So really creating those personable contacts, those relationships. And right now, I totally equate Zoom as in-person visits because that's the closest thing we can get at the moment. But having those really personal experiences with the office, the staffers, or the member themselves is going to be a lot more influential than a phone call or an email message. Not to say that those aren't important actions, they certainly are, especially when things are happening really fast on Capitol Hill. But starting to build those relationships so that when you do call or email, they'll be like, oh yeah, I remember Shannon. She came into my office, we visited, and I remember what her story with rare diseases was and why this would be important to her. And I like to show this roadmap. We've all seen how a bill becomes law. But this really outlines too, also all the different steps there are for advocacy. So there are so many different times that you could be advocating throughout the legislative process, from before a bill even gets introduced up until there's votes for particular legislation. So each of these steps is a point where action and advocacy can be taken. And you never want to wait until it's too late to advocate, to make your voice heard. You never want to have those regrets because calling your office or emailing that office might sway a member from taking a certain vote or acting in a certain way. And so this will be, you can see how this might impact advocacy as Congress continues to work on the Build Back Better Act, that reconciliation package that we keep on hearing about in the news, or next year when Congress starts working on Prescription Drug User Fee Act reauthorization, both of which will have large impacts to the rare disease community. So how do you even get started? How do you advocate? What is it all about? Really, you're building relationships with your state and federal legislators, sharing your story, making sure to have an ask. And many times that you might just want to go in and be educating your members about your rare disease, because most likely they've never heard of it or know what it's like. But you're continuing to build those relationships, asking questions, engaging with organizations like you're doing today with Rare New England and other organizations. Another way to kind of get started in advocacy, you don't have a particular ask, but maybe there's another organization or other rare disease advocates who have a policy goal that aligns with yours. You can support their efforts. And then when you do have a goal or are supporting other policy goals with your advocacy, activating your own network is so important. Don't just advocate yourself, ask your friends, your family, your neighbors, your coworkers, and just grow that advocacy, because we all have those networks to help us along the ways. So the first part of advocacy is determining what your goal is. And a lot of times your goal will be to solve a problem, whether that's insurance coverage of a treatment, needing a diagnosis, funding for research. And if you're not quite there yet, your advocacy can be general about promoting awareness and education too. Those are very worthy advocacy goals too. And to get started, you're going to want to engage with your legislators. So that'll mean determining whether the policy issues you're facing are local, state, or federal issues, and whether there needs to be legislation to correct a problem, or whether the problem can be addressed by an agency. So depending on the answers to those questions, you'll want to meet with the appropriate people. So for your state level issues, that'll be your governor and state legislators. For a federal issue, that will be your representatives and senators in Congress. And as you become more advanced in your advocacy, that'll be when you start to reach out to other members of committees of jurisdiction and leaders in the majority and minority parties. And then if it's something that can be fixed by an agency directly, then engaging with the government agency itself might be the best route. And of course, engaging with your representatives and senators at the same time can be really fruitful, because they can put a little pressure on the government agency as well. And when you meet with your legislators, you're telling your story, building that education and awareness. Never assume that anyone understands the problems that you're facing, but it's so important. I know that everyone's story there's so much that goes into it, and you want to tell the whole thing, but time is of the essence, especially with your representative and senators, practicing that elevator pitch so you can tell your story concisely, explain the problem and how they can fix it will help you get your point across so much better. And when to engage, really building those relationships with legislators, it's an anytime and all the time. You can schedule meetings with your members' offices here in DC. They're all doing Zoom calls right now, which makes it so much easier. When in-person meetings resume, district offices are really accessible. Those are the offices that will be in the district or in the state for your members of Congress. And that's where your members are during their work periods. They're in the district, that's where they live half the time. That's where their families are still. And so those meetings in the district are a really easy way when in-person meetings resume for you to meet directly with your members of Congress or their staffers. And then pay attention to a bill's progress. If there's a particular bill that you're watching, whether you support it or oppose it, pay attention to whether it's having hearings in committees or headed to a vote in the House and Senate, and schedule the meetings when you see that things are progressing and they're moving. Even if it's, good movement and you're supportive of it, you want to keep it on that trajectory, right? You don't want something to come out of the blue and stop it from keep going through the process. And so even if you're supportive of it, you want to continue that to go, and using your voice to make sure that it continues as you want it to is important as well. For state legislatures, their calendars are different depending on which state you're living in. Some states meet once every other year, some meet in the beginning of the year and not towards the end of the year. So check those calendars for your state legislature so that you don't miss out on an opportunity to advocate with your state legislators. And you definitely don't want to wait until it's too late. Be vocal early about the issues you care about so you don't miss a chance. And no matter how you engage, make it personal. There are so many different ways to engage. In-person meetings is one of those, but also holding briefings, attending op-eds, and media and social media is such a great advocacy tool. Making legislators aware of the problems you face, thanking them for the actions they take. When you do meet with them or have a call with one of their staffers, thank them for that opportunity and thank them for listening. And then tagging members with photos you took at the meetings, they always appreciate that opportunity. And so, like I said, advocacy is about persistence. So that means even after a meeting or after a phone call or after an email, you can't just stop there. If it's an issue that is really important to you and has a big impact on your life, you have to just keep going. And so that means following up with the offices after you meet with them, making sure that when they say that they might be willing to co-sponsor a bill or sign on to a letter, following up with them and making sure that they actually do it. And then continuing to make sure you know what's going on. Sign up for the members' newsletters and follow them on social media. That makes it so much easier to look for different opportunities to engage with the members. So many of them, when in-person events happen, they'll have a coffee chat at the local coffee shop in the district, or a town hall meeting, or be attending other events. So those are great opportunities to be able to walk up to them and say, hey, introduce yourself and tell them a little bit about yourself and what is really important to you. And so if you aren't already an advocate, I know that Rare New England does amazing things, but I want to offer RDLA as a resource as well. rareadvocates.org. You can find tons of information on our newsletters and webinars and other events to stay informed on really key policy issues. And if you are really raring to go, we will be opening registration for Rare Disease Week on Capitol Hill, which will be virtual in 2022. And we'll be opening up registration in December for that event. And it'll be in February and March. So keep an eye out for that if you are interested in participating. And I see Lisa, so I'm going to go ahead and turn it back over to her. But if there is anything that you have questions about after this session, or are really interested in getting involved in, or just want to know how to participate, you can email me. My email address is there at the bottom, svonfelden@everylifefoundation.org.
Excellent. Thank you so much, Shannon. If anybody has any questions, you are welcome to put them in the chat. I do have a couple that I wanted to run by you, because I think there's some really good advice that I've heard over the years through RDLA and other forums. But what would you tell somebody who is afraid to share their story? Because I'm guessing there's a lot of people out there who, you think of Capitol Hill and you think of, these these congressmen and it's scary. And so I'd love for you to tell us a little bit about what you would tell somebody like that.
Yeah, I think, we're all comfortable sharing different amounts of information, for one thing. I mean, I have friends who share a lot more on social media than I would ever share on social media. And so I think that's totally fair, right? You don't have to tell everything that you've been through. So I think just figuring out what you feel comfortable sharing is a great step. I think also just realizing that they're really just people. They have problems. They're not perfect. I mean, read the news. they're not perfect people either. And so I know it can be especially really intimidating, especially when you come to DC. You're walking these marble halls and it's really busy and crazy and everyone's wearing suits and ties, and it can be a very intimidating feel. And so I think too, if you're really feeling a little bit like you want to dip your toe in it, I would really encourage you to reach out to your district offices of your members and schedule a meeting to speak with one of their staffers. And I think that's a really nice way to kind of get your foot in the water and start to feel more comfortable. Practicing to tell your story is so important, especially because you do want to kind of be concise and short and to the point. And so I always recommend folks to record themselves. I hate the sound of my voice, but even sometimes I will go back and look at how I was speaking at a public speaking opportunity to improve. And so timing yourself and looking back, those are really great tools to just practice and feel a little bit more comfortable with the process.
Right. That's great advice. I think it's been many, many years ago since I first advocated on Capitol Hill, and I'll never forget it because I told my story, and I'm pretty certain that the senator's jaw had dropped because I was a young stroke survivor and you couldn't see it. So it was shocking. And that was the very first moment I realized I don't need to know policy. I don't need to know statistics. I just need to tell my story. And I think that is what, as a patient or even as a researcher, you need to know your piece, and then you have people around you or organizations around you that can help, like RDLA or Rare New England. Yeah. There's one other thing, I don't think you mentioned it, but I was hoping you could talk a little bit about the burden study. That was definitely a big deal. And I know that's not really in your field, I guess, because I know you do a lot more advocacy, but if you could just kind of give a high level overview of what the organization did and kind of what the main takeaways were on a very high level, if you could just explain that to everybody watching.
Sure. Yeah. So the Every Life Foundation commissioned an economic burden of rare diseases study. So economic burden, using the word burden, that's a very economic term. And this had really never been done before. So we were trying to really understand what is the cost of rare diseases, because we understand that families are facing, expenses beyond just the cost of treatments, or because there's caregivers, there are the loss of jobs, there are a lot of direct costs, but there's also those indirect costs. So this study really looked at both of those. And we did a survey to really understand those indirect costs. And then we also looked at Medicare, Medicaid data to get those hard direct costs. And so we looked at about 379 rare diseases. So that's only a fraction of how many rare diseases are out there. There are over 7,000. There are even some estimates out there that say 10,000 rare diseases. So 379 rare diseases is a drop in the bucket. But the economic burden of rare diseases study showed that just out of these 379 rare diseases, there was almost a $1 trillion cost to the United States in 1 year. So that was done in 2019. And so it shows that the cost of rare diseases, the costs of not treating rare diseases or having cures, right, is having a really high economic cost for not only our families and patients, but also for the country itself. And so this is the first time this has ever been done. And actually, the Every Life Foundation worked a couple of years ago to get legislation passed, commissioning a study with the GAO, the Government Accountability Office. And so the results of that study were just released last week, I believe, as well. And it was mostly a literature review, and actually our economic burden study was referenced in it as well, but it also has some really interesting information too.
Wonderful. Thank you. I know I think I put you on the spot on that. And so great, great thinking on your feet and figuring out, the numbers. So I appreciate that because I know that was a very, very big project and something that really needed to be done. And so it was great that the organization did do that. So we are coming close to our time. I have one final question. And this is a little bit of a personal question that I came up with because I was thinking about it. So I do advocacy for a couple different organizations. And I think of it as a positive because I have different touch points with legislators throughout the year, some for Every Life, some for the Heart Association. So different organizations. Do you think that's a positive thing, or do you think it's too confusing to have multiple kind of opportunities?
No, I think it's a great thing. Being a part of RDLA, really our goal is to support patients and other organizations with their advocacy efforts. And obviously there are over 7,000 rare diseases. There are so many things that need to be changed or improved for the rare disease community. And one single organization definitely can't do it all. And so I think it's great that there are so many different organizations that are helping to carry the water for the rare disease community, and to be a part of that, I think is a wonderful thing.
Awesome. Thank you. And that's kind of how I see it. The more touch points I have and the more they can remember somebody, the better it is for all of the asks that you have. But I was curious to see what the perspective would be. And with that, I want to say thank you so much for being here. I think the power of patient advocacy is there and is available. And so I encourage everybody to continue to fight that fight and become a patient advocate if that's something you haven't dipped your toe in. In terms of Rare New England, I did want to mention that I think momentarily the raffle is going to be ending entrances. So if you want to go right now, you can buy a opportunity for the raffle because that will be ending. And I think the only other thing was continue during our breaks if you want to network. I'd love to meet people who are here. So please reach out if you have that opportunity. And thank you again, Shannon.
Thank you. And I put my email address in the chat too, if anyone needs to grab it there, as well as the link to the burden study. It's burdenstudy.org, but the link is in the chat too.
Awesome. Thank you so much.
Thank you. Have a great day, everyone.
You too. Bye-bye.